about this. So we started speaking about practical exercise. And now let us have a look. What should we do? We should change the sentences into the passive voice. Well, and let us start with the Arun Chalam. So,
Ma'am, here the needle is inserted by the doctor.
Okay. Great. And so do we need to mention the agent? Does this sentence require an agent?
No, ma'am. The needle is inserted.
Just that's it. Yes.
Yes, ma'am. Because often in that kind of words it is necessary, ma'am. In this sentence, it's not necessary, ma'am.
I see. Okay. So now,
Yes,
please, Madhumita, the second sentence is for you.
This procedure is often performed by nurses.
And here, does it require? I didn't get it.
No. Agent is nurse. I told agent is nurse, ma'am.
So, so this sentence requires an agent. So we should use by nurses.
Yes,
okay. Well, the next is for Divya. Read the sentence here from the screen, number 3. Divya.
Yes, ma'am. The doctor then applies gentle pressure to the puncture site.
So we should start with the gentle pressure. Yes.
Gentle pressure
is so.
Ma'am, the gentle pressure puncture site is applied by the doctor.
A gentle pressure to the puncture site is applied by the doctor.
An agent is a doctor.
So the agent is a doctor. We can omit the doctor by the doctor and just leave the gentle pressure is then applied to the puncture site. That's it. Well, the next is number 4. This is for Priya.
Yes, ma'am. The sister explains the procedure to the patient. For this, the passive voice will be the procedure is explained to the patient by sister.
And do we need by sister here?
Yes, ma'am.
So
by the sister, ma'am.
Or can we live without the sister? So we can omit by the sister here. So the next is for these guys are absent. For Prerna, please. Prerna.
Yes, Fifth sentence is the nurse cleans the skin. The skin is cleaned by the nurse.
By the nurse. Or just the skin is cleaned. That's it. Well, and Nishat?
Yes, ma'am. The doctor taps the vein. Ma'am, the vein is tapped by the doctor. And the agent here is the doctor. Like he does that.
The doctor, so training is not.
Oh, sorry, ma'am. I skipped that question. Like this emergency procedure, like without training. Wait a minute. This emergency procedure, like is without training, don't perform by the doctor.
Is not performed by the doctor, by doctors without training. Yes.
Yes, ma'am.
This emergency procedure is not performed by doctors without training. Okay, yes, so good. That was who?
Nishat.
Nishat. Okay. Now Prakriti. Next sentence, number 7.
The doctor tapped the vein. Ma'am, the vein tapped by the doctor.
The vein is
Tapped by the doctor.
tapped.
The vein.
So there should be at least there should be 2 words in the passive voice verb. So is tapped by the doctor. Okay. And the next is for Samhita.
Yes, ma'am. The statement is generally nurses don't perform this procedure, and the passive voice will be this procedure is generally is not performed by the nurses.
Yes, this procedure is not generally performed by the nurses, and we need an agent here in this sentence.
Nurses.
Okay, by the nurses. Mhm. Well, good. So we refresh the passive voice, and it's okay now. Let us focus on the this picture here. There is a gastroscopy procedure described in the picture, and we should match. We should use the words which are given here to the right to label the elements of this instrument here on the diagram. So, what do you think of number 1? Which word should be used here?
Can I, ma'am?
Yes.
Yes, ma'am. The number 1 is, ma'am, like B, ma'am, side channel for introducing other instruments, ma'am.
So number 1 is sorry.
An endoscope.
Yes, ma'am.
Endoscope.
Endoscope, ma'am.
Okay,
Endoscope.
number 2. What about number 2?
Number 2 is the side
Miss
channels
side
for
channel for
Side channel for introducing other instruments.
Yes, other instruments. Number 3.
Number
A flexible tube.
a flexible tube.
The 4th.
Yes, ma'am.
It is
Yes,
a grabbing
Grabbing instrument.
Yes, and number 5 is what?
a
Is a
light and
camera.
camera.
Light and camera.
The light and camera. Yes.
Yes, ma'am.
Okay. So I think even not medical specialists can easily understand this procedure looking at this diagram. So, and well, now there are some statements here. They're taken from a training session for doctors. And you see that there are several gaps in the sentences. And we should complete the sentences by choosing a word from either the noun group or verb list of verbs here. The nouns are section, consent, patient, air, endoscope, mucosa. Do we understand everything here in the noun list?
Yes, ma'am.
Mucosa, do we know the meaning of mucosa?
It's a layer.
The inner layer of the one of the layers.
The ventricle, ma'am.
Layer of mucus.
And yes, and the verbs blow, advance, swallow, give, obtain, sedate, anesthetize, and biopsy. This is a verb here in this context. And you see that most of the verbs here are used in passive voice. Yes, most of the verb should be used in the passive voice. That is why we need to change the form of the verb. If it is, for example, blow in the passive voice, it should be is blown or are blown. If it is advanced, we should say is advanced or are advanced, and so on. Well, let us do like this. I give you several minutes to look at all the sentences and to take notes on paper about the forms and words which are missing here. And then just in several minutes, we'll check. Okay, So let it be like 5 minutes. Everyone please work individually and write the correct sentences on paper, and then we'll check. Okay? Is the task clear?
Yes, ma'am.
So start, please.
The pharynx is low using a spray. Informed patient. Patient is asked to blow off.
So now it's time to check what you've done. Well, we stopped with Prakriti, right?
Yes,
So,
ma'am.
please, Samhita, what did you read in the first sentence?
Ma'am, the first sentence is inform dash is dash. So inform patient.
Inform constant inform
Consent is given.
consent
Inform.
is given. Constant
Uh,
consent is given.
Yes, informed consent. So as you remember, consent is like consent for an invasive procedure. Yes, but
Yes.
we should get this consent from the patient. Which verb is better to use here? Informed consent is
Given.
no.
Is give
Is obtained.
give
Is
obtain
obtained. Is
obtain.
obtained. Okay. So the next is Rafa, please.
Yes, ma'am. The pharynx using a spray. The pharynx is blown using a spray.
So what kind of spray is it?
Or the pharynx anesthetized using a spray.
Yes, is anesthetized using a spray. Right. Okay, the next is for Ayman, please.
Ma'am, the patient is dashed to induce drowsiness. So, ma'am, it could be anesthetized or maybe sedate to induce drowsiness.
What is the form of sedate then? The patient is
Sedated. Sedate. Ma'am, I think it's the correct form. Sedate.
sedated. Yes, the patient is sedated to introduce drowsiness.
Sedated to induce.
Passive voice. Well, now please, Arun Chalam.
Yes, ma'am.
The fourth.
The dash is introduced and is dashed further down the esophagus into the stomach and lower down. The endoscope is introduced and is advanced further down the esophagus into the stomach and the duodenum. Is it right?
Exactly. Yes, right, you are. Okay. Well, the next is for Madhumita. Number 5, please. Madhumita, are you here? No, minus. Divya. Hello, Divya. No, Divya. Priya.
Yes, ma'am.
Number 5.
Yes, ma'am. Dash is dash into the stomach via side channel to the endoscope to allow visualization of stomach mucosa. Ma'am, in this endoscope is
But this is via side channel or in the endoscope. It should be something else.
Ma'am, it can be section is advanced into the stomach via side channel.
I missed the first word. Section.
Ma'am,
Section.
Section
Or
is advanced. Section is advanced.
Or if we speak about, can you use any other, look at the noun list.
Solomon.
Patient is biopsied.
Patient, no. There is a side channel in the endoscope. So, and what can we just try to use all the word section. We've tried with section. Consent can't be used. Patient, no. What about the next? Air. If we start with air, so air is what?
Blown.
Yes,
Blown.
is blown
Blown.
into the stomach. Okay. So then the next sentence is for Prerna. Number 6.
Yes, ma'am. The dash is dash a plastic mouth guard to bite on. For this one, I was completely confused, but I will try.
Yes, do it. Who can bite? Bite.
Bite. Patient. Patient.
The patient.
The patient is anesthetized. No.
No. The patient is
given.
Yes, exactly. The patient is given a
Patient
plastic
is given a plastic mouth. Yes.
Okay. So then the next sentence is for Nishat.
Yes, ma'am. The patient is asked to dash the first dash of the endoscope, ma'am. The patient is asked to swallow, ma'am, the first section of the endoscope.
Right. Yes. To swallow the first
Thank you.
section of the endoscope. Okay. Then Prakriti.
Ma'am, the patient. Yes, ma'am. The stomach dash is dash using a thin gramping instrument which is passes down a side channel. Ma'am, the stomach and ma'am, it's mucosa. Mucosa is endoscope using the thin gramping instrument which is passes down the side channel.
So we need to use the verb in the second dash. The stomach mucosa is
given.
Obtained.
We've used obtained in the first sentence. We
Biopsied.
Biopsied. Biopsied. Yes. Okay. Well, this is the way that we can describe the gastroscopy procedure, and actually these sentences are given here on the screen on this slide, and so I think the task here is to put the statements into the correct chronological order, and I think that the first stage is given correctly. I mean, first informed consent is obtained, right? So what do you think of the second stage? What is the second
Sedated,
stage?
ma'am. The patient is sedated. Drowsiness.
Okay, yes, the patient is sedated to reduce drowsiness, or the pharynx is
Then it is anesthetized.
anesthetized using spray. Yes, just okay, let it be. So we have 3 stages now, 3 steps. Now the 4th step, what is it?
Then the patient is asked to swallow the first section of endoscope.
Before he is asked to swallow, so
You want a plastic mouth guard to bite on.
yes, the patient is given a plastic mouth guard to bite on. Okay, so this is number 4. Number 5, so as we say, the patient is asked to swallow the first section of the endoscope, right? This is number 5. So which step goes next? Number 6.
The endoscope is introduced. And
Endoscope is introduced.
Yes, ma'am.
Yes,
Yes,
this is
Esophagus
further
and
down
into the
the
stomach and
esophagus.
duodenum.
Okay. This is number
Then add
6.
it to the stomach
Number
via side channel.
Yes, number 7 now.
Air is blown into the stomach
Air
via
has
side channel
through a side
for the
channels in the
visualization of the
endoscope to
stomach mucosa.
allow visualization of the
Visualization of
stomach
the
Exactly.
mucosa.
And the last, number 8.
What's the
The
last one?
stomach
Mucosa is
mucosa is
biopsied
It is
biopsied
using a
biopsied
thin
using a
grabbing
thin
instrument,
grabbing
grabbing
instrument,
which is
passed
down a
which is passed down a side
down the
channel.
side channel.
Okay, great. So we understand the succession of these steps well, and now let us move to the next slide. Here we have so the illustration of the conversation and between Dr. Quinn and his patient, Mr. Beacon. Let us listen to Dr. Quinn explaining the endoscopy to his patient, and so we should understand which steps from the previous slide the doctor mentions. So these steps, and just you've written them down on your paper when we were doing this exercise, right? So you have these steps here. You can see them. Now we are going to listen, and you tick the steps that are mentioned by the doctor. And you tell me if you can hear.
Listening to. I need listening to.
Yes, ma'am, we can hear.
Yes.
Yes. Now.
Listening to.
Mhm.
I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
So did the doctor mention all the 8 steps?
No, ma'am.
No, ma'am.
Only like
Only
4, ma'am.
No, ma'am.
points.
How many?
Only 5 steps. 5,
5
ma'am.
steps.
Ma'am, around
Five,
6
five,
points.
ma'am.
Ma'am.
5.
6 points.
4 or 5.
Okay. So which of them?
Ma'am, the
Ma'am, the
first one is
one is
from
the
consent is
consent
obtained,
is obtained.
Then the
and the
consent is
Consent is
second
obtained.
is
Air,
The
and is
process is
pharynx and the
air,
sides.
and ma'am,
and the
air is blown
third
into the
is
stomach.
starting the tube, then blowing the air.
Blowing
Yes,
the
ma'am.
air.
The
And the
air, yes, ma'am.
the third one is the
Then
endoscope is introduced, and fourth is air is
visualization,
blown
ma'am.
into the stomach.
Okay.
and the mucosa is biopsed.
Yes.
Ma'am, taking the
last.
sample
Air
of
is
mucosa, ma'am.
blown. Then air is blown into stomach by side channel for
Using a
better
spray.
visualization.
Using a spray.
Visualization of this.
Okay. So
Yes,
about
ma'am.
the
Using a spray.
consent, about the sedation,
And also
about
He said that he will spray
about the
spray,
spray.
ma'am.
something on his
Spray.
throat.
Yes,
for
about
numbness.
Even number 4, ma'am.
endoscope.
And then he will introduce, and the air is blown.
Endoscope is introduced and
Yes,
air
ma'am.
is blown.
And he
Yes,
talked
is
about
blown
the
into
air
the
is
stomach.
blown into the stomach.
Biopsy.
Yes, ma'am. Even the last point.
And the stomach
Yes.
is then
Yes.
stomach mucosa is biopsy.
Using
Okay,
a thin
okay.
grabbing instrument.
Great. And
Listening to.
now, so we're going to listen for the second time, and you see that the doctor didn't say these words like anesthetize, pharynx, biopsy, sedative. He used some other words. We were speaking about this, that to make it easier to a patient to understand, the doctors need to use some simplified non-technical language. And now let us focus on the words that the doctor uses instead of these technical medical terms. Okay, the same conversation, the same piece of information, but you should use the words that are synonyms to be given here on this screen. Okay.
Listening to. I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
Mm-hmm. Did you get all the words? Or do we need to listen?
Can you repeat it once?
Yes, okay.
Yes, ma'am.
Listening to. I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
Mm-hmm. Esophagus. What is which word is used by the doctor instead of this?
Gullet, ma'am.
Gullet and stomach.
Gullet.
Gullet.
Okay.
Gullet.
Gullet, ma'am.
Anesthesize.
Help you
Numb.
to relax.
Numb.
Yes, he says
Numb.
numb with a spray. Mm-hmm.
Numbness with the spray.
Okay. Instead of pharynx.
Throat.
Throat, ma'am.
Throat.
Throat, ma'am.
Throat.
Instead of flexible.
Bendy tube.
Bendy
Bendy
tube,
tube.
ma'am.
Bendy tube. Biopsy.
Tissue sample.
Tissue sample, ma'am.
Tissue sample.
Yes, he says we are going to take a tiny tissue sample. Mhm.
Yes, ma'am.
Instead of sedative.
Biopsy.
Sedative.
Something to relax.
Something he will give
Relax,
to
ma'am.
relax.
Something to relax.
Something that, to help you to relax. Okay. Instead of examine.
Tiny camera will be there to see
To-
what is.
No, it is for
Tiny camera.
visualize.
Oh, it's for
For check.
visualization.
Not see, but to look
Look.
at.
For
To look at.
Look.
So examine, to look at. So eructate.
to
Blow
cut
air.
lungs.
Blow
If
air.
anything is there.
To
So
blow,
Blows
ma'am.
air.
To blow air.
So he uses such word as belch. Belch. This is when the air goes outside the stomach through the throat. Yes, belch instead of eructate. Okay, and instead of visualize,
To look or see better, ma'am.
see. Yes, so we can see, like the doctor says.
yes.
Well, this is just a good example how to make.
Mhm.
So the explanation simple and so that the patient can easily understand the explanation of some kind of procedure. And
Listening to.
yes, here the words are given. So this difficult word, belch, maybe we don't know this. So, and well, so what I want you to focus now is the following. So yes, you see, we were speaking about
Yes,
passive
ma'am.
voice structures. And I'm going to attach some file to the Moodle site that will be the home assignment, and there'll be some sentences, and you should decide which verb to use in each of the sentences, the active voice, verbs, or passive voice. So you can find it on the Moodle site. And
Okay, ma'am.
this is the task for the next class, because